Hi, my name is Alvin Shiang. I'm a pharmacist at Northeast Medical Services. For today's program, I would like to provide you some information about the flu virus, as well as steps you can take to prevent yourself and your loved ones from getting the flu. So what is the flu virus? The flu virus is a contagious respiratory illness that can possibly infect the nose, the throat, and sometimes even possibly the lungs. The symptoms typically include possible fever, headache, runny nose, stuffy nose, sore throat, cough, muscle aches, and fatigue. For most people who end up getting the flu, the symptoms typically last for between a few days to up to less than 2 weeks. However, there are some people who may experience some complications from the flu, such as pneumonia, which may lead to hospitalization. These groups tend to include patients that are 65 and up, if you're children age 5 or less, if you're a woman that's pregnant, if you have a body mass index of 40 or higher, or if you have any chronic illnesses such as diabetes, asthma, or other heart conditions. So, how does the flu virus spread? The flu virus typically spreads through respiratory droplets that's created when an infected person either talks, coughs, or sneezes. These respiratory droplets can travel up to 6 feet. So, if you're within close vicinity of someone who's infected, there's a high likelihood that you may become infected. Also, if you touch any contaminated surfaces that contain these respiratory droplets that has the live virus, that also increases your risk of getting infected as well. Just make sure you don't touch your mouth, your nose, or your eyes afterwards. That's why the best way to prevent yourself is to make sure you wash your hands with soap and water. So how do you prevent yourself from getting the flu? The most important thing you can do is to make sure you get your annual flu vaccine. The flu vaccine protects you for up to 6 months, and it also reduces the likelihood of you getting any serious complications from the flu. It also reduces the risk of transmission as well. The second item you can do is make sure you increase your hand hygiene. Wash your hands with soap and water as frequently as you can, and make sure you don't touch your face. Third item you can do is to make sure you open the windows in your home if there is flu inside your home. The reason is the clean air will help wipe out the flu virus. The last item is to make sure you wear a mask, especially if you're going to be in places with a lot of people, for example, the airport. As I mentioned before, the flu vaccine gives you protection for up to 6 months from the flu. The flu vaccine also will make sure you don't transmit the virus to anyone else. This will not only protect yourself, this also protects your loved ones, your coworkers, as well as other members of your community. Now, if enough members of the community get vaccinated and get protection from the vaccine, this decreases the risk that the flu will be infected to another person. If enough people get vaccinated, this might lead to herd immunity, which is the goal of every healthcare professional. So please, for the upcoming flu season, make sure you go get vaccinated. If you have any questions, make sure you talk to your healthcare provider or your pharmacist. We want to make sure that you not only protect yourself, but also your community. Now, when's the best time to get the flu shot? The flu season typically starts around October and ends in May. However, height of the flu season is usually around December to February. That's when there's highest rates of transmission. As I mentioned before, the flu vaccine gives you protection for up to 6 months, which is why it's recommended for you to get your vaccination sometime between September through October. That way, during the peak of the flu season in December through February, you'll still be fully protected. So the last thing I want to mention is if you're age 65 and up, there's actually a different kind of flu vaccine that's recommended for you. In fact, there are 3 different ones you can choose from. The first one is Fluzone HD, the second is Flublok, and the third is Fluad. The reason these are recommended for patients 65 and up is because they provide better protection compared to the regular flu vaccine. As you age, your immunity decreases, so if you get the regular flu vaccine, it won't provide you with as much protection, which is why these 3 vaccines are recommended for you if you're 65 and up. So for this upcoming season, when you get your flu shot, make sure you talk to your healthcare provider or your pharmacist to make sure to see if you can get one of these 3 vaccines. Thank you for watching.